Hi, everybody. Welcome to another episode of ASAP Pathway. I'm your host today, Dr. Stacy Ochoa, and I am so excited to have the guests that we have on today. I have just not only the honor of saying I get to be a colleague with this woman, but I get to be friends with her. And, when you find that person that you kind of feel like you jive with, and I mean, just not many people get our lives, right? So without further ado, Dr. Jill Ombrello, thank you so
Oh,
much.
of course. Thank you so much for having me. I'm actually like a little giddy and excited. You are so busy and all over the place. The fact that I get just to chat with you is so exciting to me. Like, it's almost like if I saw a Kardashian, I'd just be
What?
like, I know that's controversial. I don't know how you feel about the Kardashians,
No, but
but
that makes me
take it or leave it.
laugh.
If I saw Kim Kardashian, I'd probably freak out a little bit. And I'm kind of feeling that way talking about you, talking to you right now. I'm like, oh, it's a Kardashian. It's Stacey Choa. Oh my
Whatever, Jill.
God.
Well, it's so funny because, I want to go into, we have so much to say, and it's so hard to squeeze this in a bite-sized time frame. So I'm like, if we need to do a two-parter, which I have a feeling we may want to do someday, let's do it. But I know you're busy, but like Jill Umbrello, I mean, you've been in the trenches doing this for years. You were doing it before I was. So I was
I
hearing
mean,
your name, meeting you. I remember the first time we met in person, I think was at the ADA first symposium where they started saying, we need to be screening these kids and it's the standard of care.
yeah. And it was wild. I was so honored and privileged to be invited to the roundtable the day before everybody kind of got there and talked about it. And I'm sitting at this roundtable, and everybody has the same mission, and everybody is looking ultimately to help these kiddos be healthier, right? And everybody has their own idea and their own bias on how that can happen. But this is a really great group of people that was very airway focused and very sleep
Right.
centric, and so it was great. And as I'm hearing these people talk about it, and mostly just awesome mentors of mine and people that are out there and lecturing, I couldn't believe how complicated they made it sound. I couldn't believe that they were going to take this language that we were having at this roundtable back to their patients, back to their neighbors, back to their friends, back to moms or dads or grandparents, whoever it was, and try to relay the importance of this information. And so that's when I was kind of like, hello, like, hold on. Yes, we can argue literature and research, and let's do that. But also, let's know when we just need to stop for a second and explain this in a way that makes sense to the mom who just thinks she's going to get her kid's teeth cleaned, or
Amen.
the dad who's like, I don't understand why my kid has 8 cavities, we brush his teeth every day, or to the defeated parent who has a laundry list of medical concerns. And so it has become my passion and my ultimate goal to really take what we're all doing here, but break it down in a way that the most simple of minds can understand. And by the way, the reason I can do that is I have a simple mind. Let's not overcomplicate things. Let's
Right,
take
right.
what
Let's not.
what appears to be very complicated and break it down into bite-sized pieces so that we can all understand what we're looking at, and then we feel very empowered to make decisions. And I love giving information. I love to talk. I think we have that in common, Stacey. I think that's why we get
Yes.
along. I do remember that 88, you and I forget who introduced us, it doesn't even matter. You and I
You're
were
right.
like outside chatting away. Someone else was lecturing, they're like, shh, and so we stepped outside and
Yes, I
chatted.
remember. Well, I was
I just
standing in
love it.
line waiting to get my opportunity to talk to you. You had a
Gosh.
line. And I remember being so excited because we had I think we talked on the phone a couple of times about some
Yeah.
cases, and I wanted some advice from you because you had been doing this longer than I had. But I just remember waiting in line. There was like all these people in line, and like, I can't wait to meet her. So I have I'm one of your biggest fans.
Oh,
So
that's so
it's funny
sweet.
that you're like,
Well,
oh, but I mean,
Well,
I just,
funny side story to that. I was wearing these super cute heels, which I don't really wear those anymore, but my heel broke right before I lectured. So I had to, one of the guys gave me super glue. So I had to super glue it. So I was standing like a Barbie, like my foot was, anyway, it was a big disaster. So
how
I was probably
hilarious.
quite impatient. I should have just kicked my shoes off. If that happened today, I'd just take my shoes off and be barefooted. But
Today, it's so
back
funny.
then
Nowadays, it's like,
I
just
tried to be fancy.
kick the shoes off. So if you could, because again, our audience will have, we have clinicians, we have parents. So tell us a little bit about your background and
Yeah.
why you, because really this is really about the book launch that you just had, Moms in the
Yeah.
Trenches, which I am so excited about. And this is the perfect title. I always joke in my, when I give a presentation, I have a slide that says, no one does more research, or no, a worried mom does better research than the FBI. But
Yeah.
it's because of that. But tell us a little bit about what you do. What do you
Yeah,
do every day?
absolutely.
Why did you get into this? What's going
Yeah,
on?
absolutely. So, I'm a fourth generation dentist in Dallas, Texas. And so I'm here at Central Dentist and I'm just plugging away, just like all the other dentists. And I'm looking at my patients and I'm hearing their concerns and I'm trying to provide solutions. And gosh, when I first started this, I can't believe it's almost been 20 years. How am I? I mean,
I
don't be
know.
surprised by this youthful appearance. It's getting old, people. I know we were talking about that before, but I couldn't believe what parents were dealing with and what with their own kids, and they were chasing these symptoms around. And I have four children of my own, and so as I saw them struggle or try to figure out how to make them healthiest. One, I felt super overwhelmed because I didn't even know where to start. And then second of all, I didn't want to treat the symptoms. I really just wanted to find the root cause to help them. And so one thing, thank you for mentioning the book. One thing I talk about in my book, Moms in the Trenches, is my background, why I feel so passionate about educating and empowering patients. I had a horrendous medical situation in my early 20s. I was actually in dental school, and I had a botched heart surgery.
Mm,
So I had to have a second open heart surgery. And, for a very long time, I was very angry. I was very bitter. Why me? Why did this happen? And instead of just being angry about it, I decided to turn that into a blessing and say, I went through this so that I would never be that type of doctor who just told me what I needed. And the cardiovascular surgeon says, you need this. You were born with this hole in your heart. You have to close it up, rather than educating me about all of my options. And so it really has made me become a very critical thinker, but also someone who's very passionate about explaining it in a way that parents can understand. Because if I understand one thing completely, it's that moms and dads, I'm not trying to leave the dads out, but parents are exhausted. We
mhm.
are tirelessly trying to help our children. We want so much good for them, right? They're not just playing football. They have private coaches for football. They're not just in school. They have tutors for school. I mean, there's just so much opportunity for them to be the best little versions of themselves. And part of that is what they eat and what they drink and what they sleep and what they think about, and getting the sunshine. So this book really breaks down small bite-sized pieces about how they can do that. And really what I'm talking about in this book is what I'm doing every day at Central Dentist.
This is awesome. And it's so true. I mean, airway is a hot topic, but pediatric airway right now and sleep
Yeah.
is a really hot topic. So your book couldn't be any more timely than it is. So um tell us what moms in the trench, what does that mean? Moms in the trenches.
It, it
What do
just
you
mean,
mean?
and that can mean anything. I think it refers to the mom who's up late at night thinking about their kid, worrying about them. Am I doing the right thing? Am I making the right choices? Are we eating the right food? Are we why do we have cavities? Why or do we should we get the tonsils and adenoids removed? Do we do myofunctional therapy? Do we do speech therapy? All the questions. It's that mom. It's the dad who is, you know, or it's the parents that sit down at the table together trying to figure out, how do we best invest our money in the health of our children? Do we have the tonsils out? Do we do the orthodontics? Where do we start? Where's the biggest impact that we can make with the decision that we make? The moms in the trenches, it's also for maybe the dentist who hasn't started yet, right? Like if I
Mm-hmm.
had this book when I first started and I could hand it out so parents could read it and understand, and it wasn't left up to me to explain to every parent why this is so important, that would have been a great tool. So this is for anybody who has a mom, or really anybody who has a child that they care about. This is a good book for them to read.
That's
And
excellent.
And I think moms in the trenches, hey, we're at war. We are fighting for our kids, and we have we have more information than we could have ever had before. Like my mom tells me all the time, she's like, thank goodness I'm not a mom right now. I don't know what I would
Oh,
do, right? I mean, she just made us some bagel bites and we got on our way when we were kids. Um, and there's
for
so much
sure.
information. And with that, there's so much misinformation. So
Hmm.
where do we start? And the answer is I don't know, but here are some basic facts that we need to look at. Here are some basic facts that your family needs to understand. What's important to you all? How do you prioritize your healthcare? How do you prioritize what you eat and when you sleep? And that really gives families additional information so they can make the best choices for them, not the choice that I would want to make for them.
Well, it's so gosh, you just said so many important things. It's like I'm in my head, I'm unpacking it as you say it. I'm like, oh, I don't want to forget what you just said because oh my gosh, we need to revisit that. The when you first said let's not overcomplicate this, right?
Right.
And it's so true. So right now our profession is complicating it, I think, so much. And I think the intention is good because they want to make sure, you know, this isn't snake oil. This is, let's show what the literature is showing. And I get it, but I mean, you can't just go by literature. We're treating kids, not
Right.
statistics.
Right.
And you can't wait till the literature completely supports one thing or another because, again, sometimes literature, you can make it say anything you want depending on what your bias is going into it. The reality is, you and I, have been doing this for a while and we know it helps children. So
Right.
when we, as practitioners, when a child walks in our front door, I love Dr. Susan Maples. She says this all the time. When that child walks through our door, they're no longer someone else's responsibility. They become our responsibility as well. And when we know better, we do better. And we can't ignore what we see and how we can help these kiddos. Um, and
But
go ahead. No, go
oh,
ahead.
well, I would say, but there's also, I couldn't agree more. I mean, she is brilliant and those words are perfect. There's also, when you're dealing with children, you're dealing with their parents who are ultimately trying
Mm-hmm.
to make these decisions. And so there's so much, in my experience, there's so much emotion surrounding that. Well, I didn't have this experience as a child. I had braces. I had my tonsils removed 4 times. I can't breathe through my nose. I have a DV. Okay, well, I understand that was the decision that your parents made at the time with the information that they had. Are you open to having additional information that may change the way you look at the same problem? Because I believe, it is my very strong belief, nothing I can do, no intervention that I have is as good as how your natural body can work. It's designed perfectly and healthy.
Yes.
And
Yes.
so, hey, we got to get you breathing through your nose. How are we going to do that? Do we do nasal lavage? Do we do surgery? Do we just blow your nose? What do we do? We have to have a big tube that takes that oxygen through your nose and delivers it to the body, and we have to have enough of it so your body, can feed off of it. How do we do that? So I am really proud when I have a patient come in. Not everybody chooses the path that I present, that I'm good at, that I believe in. Sometimes they want to have surgery. Sometimes they want to have myofunctional therapy for months. That is fantastic. As long as you understand what all of the options are, and then you can choose
Yes.
best for your kid, that's important. And I think, I don't want to say struggle, as we fail forward as practitioners and clinicians of every field, as we figure out what best practice is, which by the way, it's really tough to do. We are dealing with environmental toxins. We're dealing with
Mm-hmm.
food that is not clean, preservatives, and our water is not safe, and our air quality is not safe. So this is a consistently evolving evaluation of what is best. I don't think we ever say like, yep, this is
A
what we
hundred.
do.
And so many people, it's funny because I think in our profession, dentists, we want the answer, right? And I'm sure you get this. People want the cookie cutter answer.
Right.
Where there is no cookie cutter answer, but and I know that might sound a little bleak, but the good news is, like you said, the body knows what to do. It knows how to heal itself. Our job as healthcare providers is to remove obstacles out of that child's way so its body can do what it needs to do and compensate. There is no perfect human, perfect, anything, but it's removing the obstacles. And I'm telling you, I know you get this too. We have so many parents that come to us, especially when they hear what you're doing and out of, they feel out of hope. It's like you're their last hope. They've been to every healthcare provider. They don't have answers. They know something is just not right. and
I
they're
know.
seeing their child struggle and they're hitting walls. And so there is a lot of emotion just in many different ways around
Right.
this situation. And I love your idea of like, hey, parents, get this book, share it with your friends, share it with other moms and dads. But hey, dentists also,
Yeah.
like, what a great, like, because I tell you what, you probably get this too when we have a consultation and mom or dad, but usually mom brings in, I always say, like, we're the warrior for our children. We just are. Um, they bring in little Johnny or little Emma or whatever, and they're just, coming in for a cleaning or whatever, and they're not expecting a dentist to say, hey, I'm seeing some things that are concerning about, the growth and development of Johnny. Can we have a conversation about that? But just handing them that book and letting them go home, and just sometimes you're just planting a seed on a patient who has deer in the headlight look, right? They thought they're coming in for a cavity check. And now you're talking about their airway and their sleep and their
Or
ear.
why in the world would the dentist bring up bed wet?
Yes. Yeah. Why are
Why
you
would you
asking me my child
bring,
bedwets?
it's every patient that comes into my practice. The book just came out 2 weeks ago, but every person, so for the last 2 weeks, everyone gets a copy of the book. And I'll show you, it's not big. It's pink and turquoise. My daughter picked the colors,
Oh, I
but
love it.
it's a quick, easy read. Everyone gets it. I had a mother in yesterday and we were talking about her needs and her goals, and she has 7 kids that she wants to bring in. And I'm like, well, we're going to close the office and bring them in. But, I gave her the book. I said, why don't you read through this? If this is like-minded, if this is how you like to solve problems, if this exceeds your expectations, let's bring them in. Let's talk about it. And she came in, after reading the book. She read it in 2 days. She came in and she said, okay, this one needs this. We're going to do this. I mean, she is recognizing the problem and asking for a solution. And so we're not telling patients they have a problem. We're not
Mm-hmm.
blaming them. There's no guilt. By the way, mom, dad, it's not
Oh,
your fault. I am doing so many things wrong as a mom right now, but I'm doing the best I can.
same.
And I'm trying to learn more, but like obviously doing, and all the moms I meet and parents, they're doing the best we can. But this is a great opportunity just to kind of read. And then the patients recognize, not only is this an issue, even though it's common, it's not normal. Okay, now how do we fix it? So it's fun. It's a fun day at work when patients are asking for me to help them rather than me feeling like I'm trying to sell them. Who wants to sell people? I don't.
Right. No,
Yeah.
nobody does. Nobody
Yeah.
does. And it's so, you mentioned I'm making mistakes as we speak. I'm like, I actually ordered groceries because I didn't have time today, and bagel bites were in the bag. So I'm just going to
You
say
know what?
that.
Everything in moderation, including moderation. But
Including moderation. My daughter said, can we get some bagel bites? I'm like, fine. So
I
I
know
got the bagel
they're the
bite.
staple of a happy childhood. I'm convinced.
Right. I mean, look at you. Look at you. Look
I
how you
know
turned
I'm a
out.
product of bagel bites. What can I say?
But I
That's
love this.
hysterical.
I mean, this is um I'm just thinking, like, if you could be a fly on the wall, let's just say you walked into a room full of moms, or you walked onto the playground, or wherever maybe the mall or something like that. Um, and you're overhearing moms talk about your book. Parents, sorry, dads, I do not mean to leave you out, but most of the time it is the moms. But what do you wish you would overhear from them reading this book?
Okay, so true story. This happened.
Oh gosh.
And I wrote this book. I wrote it for my children. I wrote it so that when they grow up, they can read it and they can understand, oh, this is why mom was kind of crazy when we were growing up.
I love
Now we get it. This is why mom missed a soccer game because she was a little late because this mom had 100 questions and she didn't want to leave her. She wanted to answer the questions. This is why mom, did this. This is why we shopped at this place, et cetera. It gives them a little insight as to what is important to me. I wish my mom had written a book, like,
mm,
just to be able to get. So when I wrote it, those were really the goals. It was very healing for me. I almost treat it like a diary. I got really deep and
mm.
I said things that I haven't really said outside my most inner circle. And I'm a very extroverted person, but I'm also very private. And I just let that go. And so the book comes out and I see it and I immediately get sick to my stomach and I'm like, oh my gosh, people are going to read this. And my husband just died laughing. He goes, "Who writes a book that you think no one's going to read?" I'm like, I didn't think anybody would read this book. I know it sounds silly, but that's right. So it happened. I walked up on a group of moms. One mom is just a really good friend of mine. So she ordered it because she was being supportive. And she was telling the other moms they had ordered them. So they were talking about because they had all read it. And it just was this out of body experience. And one thing they said was, I can't believe she went there and said that much about herself. I'm so happy she was transparent. I'm happy she shared her truth. I'm happy that she's not perfect. Because sometimes they're like, oh, you work and you have children, you're so busy.
Mm.
Yeah, we're all busy, right? Like you can label it however you want. You stay home with your full-time mom. That's harder than going to work most of the time, right? So like
Yes.
whatever it is, yes, I'm busy, but so are you. So that was good. And then they started talking about the call to action that I made in the middle and the last part of the book, and how I said, here's what you can do today to get started. We don't have to change our whole world, right? Here's things you can do. And they were talking about how they had made those changes for their kids. Everything from what they packed in a lunch to one mom videotaped her kid sleeping and didn't realize that he was a mouth breather. One mom was talking about how her son was a bedwetter. I mean, this just like very honest exchange of ideas amongst these moms who love their kids. Oh my gosh, it just made me so proud because I feel like brilliant people talk about ideas, right? And
Mm.
that's Eleanor Eisenhower. Anyway, they don't gossip. And so maybe that group would have been talking about something less productive. Did you hear what she did or what she wore? Who knows, right? I do that too
Right.
sometimes. So,
Right.
but instead, they were exchanging ideas about how to make their children better and how to make their lives better and how they were eager to do that. And it just like kind of freaked me out a little. I'm not going to lie, because I still couldn't believe anybody's reading this book. But then also it just made me really proud because we all just love our kids so much and want them
Mhm.
to be the best versions of themselves. And we also love ourselves and want to be healthy and where we need to be. So it was cool. I was happy that they got out of it why I wrote it. They understand my passion. I'm really here just to provide information and then things that they could do very easily to improve their kids' health today and tomorrow and have a better understanding.
That had to feel so satisfying, so good, just deep in your soul. Like,
It was fun.
uh,
It was fun. Yeah.
so if you had to summarize, what would the success, like you said originally, I really wrote this book. I didn't even write it with the intention of anyone even reading it. It's more like a diary, like a way for you to, like, therapeutic for you.
Yeah.
And, even something your children might want to read one day. But now that it's out there and hopefully gets in a lot of people's hands, um, what would be considered this was a success to you? Like,
Yeah.
this
What a
is it.
great question. We are like getting into it, aren't we? I think when I was much younger, my goal was I want to save the world. Like I just want, if you have a good moment and you have a lot of good moments, then you have a good hour. If you have a lot of good hours, you have a good day. If you have a lot of good days, you have a good month. If you have a lot of good months, you have a good life. Like I just really want everyone to be healthy and happy. And I know it sounds cheesy. And I used to define the world as the world, this big place. And the older I get, the more I redefine that world. My family, my children, people that I care about, my friends, my patients, my dental family that comes in here. And I think that over the past 20 years, I've uncovered some important things that are working. And I don't like to learn on my own. If you make a mistake, tell me, and I will not make that same mistake. Like, let's just continue to fail forward and evolve in what we're doing. So I think that this book is a success if someone reads it and they learn something, whether they adapt it in their life or they say that's some great information but not for me. That is also learning. So I just hope that success for me is that someone reads it, they learn something, and maybe they make a better decision that enriches or helps their family or their children.
I love it. And that is going to happen. And it's going
Oh,
to
you're so
happen in a
sweet.
lot of families, sister. I know it is. I'm so
You're
excited. I'm
so
so
sweet.
proud of you and I'm so excited. I can't even tell you. Like, it just feels so good to have someone I just admire and care about just making such a difference. And again, selfishly, I'm like, I get to call you friend. And I just think that's
I'm right
wonderful.
back at you. You're always so supportive, and I just love, you know what? You are, I mean, you're a mom I want to be in the trench with. Like you are supportive, and you are, um, just rooting for me as much as I'm rooting for you. Your success is my success. ASAP Pathway
Amen.
is just amazing. And I just, I'm so honored to call you a friend too, because like I
Thanks.
said, you're someone I want to be in the trenches with. I want to be in there. I want to know what you're doing, what you're thinking, how you're solving problems, and learn from you too. It's amazing. Just love being your friend.
But thanks. Back at you. Back at you. How do
Absolutely.
people find this book, Jill?
Yes, absolutely. The book is available. It's called Moms in the Trenches. It's available on Amazon and Kindle right now. It's actually the number one new release on Amazon right
Oh,
now. So if you type it in,
congratulations.
you'll find it. Thank you. It's a hardback and a paperback. And the Audible should be coming in the next few months.
Oh,
So if you could
exciting.
handle this voice for a couple of hours, you
Oh,
can get
you're
the
going to be
Audible.
the narrator as well. I
Isn't
love
that a
it.
terrible, is that a terrible idea? I
No,
mean,
it's
if you ask
awesome.
my children, they're like, "Are you sure you should be the voice?" I'm like, "Yeah, it's shrill. It gets your attention. We got it. Maybe you should read it, Stacey. You have such a good voice.
You know what? I would love to read your book. I would.
That would be fantastic."
My brother jokes about my voice all the time. So I'm like, oh, sure. Maybe I go into a side hustle and read books or something. But I
Like you
had
have time for a side hustle.
exactly because I got nothing else to do. So
Exactly.
I'm also going to post in the link. I'll post a link to how to get to your book too. If you want to send me that, I'd love to post that. And
Yeah,
I have 3 questions I'd love to wrap up today with because I know you're busy.
let's hear it.
One, what was your favorite cereal as a kid?
Cookie Crisp.
Oh my goodness. Okay. I this is the second time I heard Cookie Crisp. It must be our generation that loved Cookie Crisp and the
Oh,
milk.
my grandmother used to have it, and my dad was a dentist, so he wouldn't ever let us have
He
sugar.
wasn't going to have
Oh,
Cookie Crisp.
2 bowls at grandma's. Oh my gosh. I mean, just what a great way to start the day. Just a big
That's
old
right.
bowl of
Grandma's like,
sugar.
Cookie Crisp for you, it is. What was your favorite game growing up?
Ooh, hide and seek.
Oh, I loved that
I
too.
loved it. I
I
was
love it
so good
too.
at it.
Oh, such a good one. And then what was your favorite movie as a kid?
Ooh, that might be Grease,
Ooh,
which I mean, no judgment on mothers, right? We're all doing the
right.
best we can. But can we maybe just question my mother's allowance in letting me watch Grease in kindergarten and putting on like black spandex and being,
Right. And having a cigarette
fancy
hanging out
Andy
of
at
your
the
hand.
end? Oh, I mean, that parenting question, I'm questioning that
I think
decision
your
for
mom's the
sure.
coolest mom ever for letting you watch Grease
I
at
mean, my
5.
bagel bites, eating Cookie Crisp, dancing to Grease. Oh my goodness, it's
I
amazing.
love it. I love it.
Amazing. I survived.
Well, thank you so much, Jill, for coming today. And
Thank you.
everybody, check her book out. Get her book. Get it in your waiting rooms. Get it in hands of moms. And moms, get this book and share it with other moms. Thank you so much for being here today.
Thank you,
And
Stacey. You're the
let's
best.
catch up
Thanks for making
soon.
my whole day. Absolutely.
Same here, sister. Talk to you soon. Thanks,
Thank you.
everybody. Bye.